All right, good evening, folks, and welcome to a special segment this evening. Thank you guys so much for tuning in. I know you guys are not used to seeing us on an evening segment, but we've got some really important information coming up for you guys. Good evening, Kevin. How are you?
I'm doing well, Sandra. How's everything on your end this evening?
Very good, very good. Wow, I haven't done an evening segment in so long that I kind of feel like I've forgotten a little bit how it feels to do an evening show. But Kevin, we are going to be busy in the evenings. I'm going to let you take the lead here for a second while I send out WhatsApp notifications. So tell people, why are we here and what are we doing?
Absolutely. So every Tuesday and Thursday night, we're going to be doing a COVID Spotlight series. It's going to be called the CMR COVID Spotlight series. It will be at 7 o'clock again every Tuesday and Thursday. And we're going to be bringing on different experts from all over the world. Going to be experts from here in Florida, experts from New York, experts just from all over the world. We're going to have them sharing facts with you because, there's a lot of disinformation out there. We want to make sure that people are getting good factual information. We know a lot of facts are also shared throughout on the morning show that Sandra does. However, not everyone is able to tune in. People are at work, people are commuting, people just aren't able to necessarily see it at all the time, as well as people might not have the opportunity or take the time really to go back and watch something that already aired. So we're going to be carrying these again live every Tuesday and Thursday night. So we hope that you're able to join us to keep on getting good information. We always want to make sure that we are really providing the best information for everyone, so they can make informed decisions. Of course, we want people to be fully vaccinated. We're encouraging people to get vaccinated, but we're not here to preach. Even though we are very passionate about that, we're not here to preach. We're just really here to provide or connect everyone with experts. Once the experts are on, you're going to be able to actually send us your questions. You could just write it on Facebook or YouTube or however you're watching us. And we're going to ask your questions to the different experts that we'll bring on. And in just a little bit, after we get through some of where we are with the current information, we'll definitely share with you on who we already have lined up and some of the other topics that you could look forward to. Again, we don't really have an end date for when this will end. We're just going to keep on going and inviting different people on, again, from all around the world to share their thoughts, their experiences. And so you could, again, completely stay informed on that. So let's take a look at the latest statistics for the Cayman Islands. I'm not sure, Sandra, if you want to kind of bring up or bring up my screen, or if you want to share that image. But we do have, as of this afternoon, which is Tuesday, September 21, the Chief Medical Officer, Dr. John Lee, reports that there have been no further updates since the morning update. At that time, there was 478 COVID-19 tests that had been carried out since the last report on Monday, the September 20th. And there were 3 positive tests from the community with that reporting. There have been 105,158 COVID vaccines given in total in the Cayman Islands. And of these, 54,681, which is 77% of our population. Our population is at 71,106, have had at least one dose of the COVID-19 vaccine, and 50,790, which is approximately 71% of our population, have completed all 2 COVID-19 vaccines. So, our numbers are slowly getting up there, and certainly not where the goal is. Definitely want to rise that by another 10-15% to be in a much more comfortable spot at a minimum. So, Cayman, you're doing a very good job, but we can do better. Let's shoot for a higher goal so we could get there. Let's take a look. There was something that was kind of new that was posted on the websites, the dashboard, and it's the active COVID cases. I believe yes, active COVID cases, and it kind of highlights some new information on that, or some extra information on that. So we do have 50 active cases, 735 are recovered. Out of those 50 cases that we have, one is hospitalized, 49 are not hospitalized, and it's a 50-50 split, more or less. 25 symptomatic, and 25 people don't have symptoms. So there are 866 people in isolation, and we remain at 2 deaths for the entire island, for that have been linked to COVID-19. And so if we kind of go on down to the vaccination numbers, again, I kind of highlighted that earlier, showing that we have a lot of people vaccinated. Again, we could still do better, and we're going to keep on trying to get in a area or a place where we're going to be much safer than we want to be the safe.
Ooh, what happened to Kevin? Looks like his feed got dropped completely. Hello, Erica, Andrea, Ingrid. Let's give Kevin a second to reconnect with us. We and Edison, thank you guys so much for tuning in. Kevin, I'm not sure what happened to you there.
Yeah, it looks like I got kicked out of the room briefly. I'm not sure if my computer did something naughty to me, but
Strange.
Oh well, I'm back.
So you're going through the graphs there with the latest COVID numbers. It's a bit interesting, actually, that the first dose is now up to 77%, which we saw trending in an upward motion from, I think it was a week and a half ago, when the community transmission started. That community transmission and the subsequent cases since then, the sort of outbreak at Georgetown Primary, seems to really encourage a lot of people who may have been on the fence to go and actually get vaccinated.
Absolutely. And that number, that second dose, will be due in probably about 4 weeks for most people, because it's 5 weeks after. So, 3 weeks after, sorry. So, in a few weeks, we're going to have a lot more people that are fully vaccinated.
Right.
It takes about 5 weeks from start to finish. So you take your vaccine, 3 weeks later, you take your second vaccine, and then 2 weeks after that is when you, pretty much have that best protection. So again, we're going to see that number rise with the increase in numbers. Let's see exactly where we are. Very excited that the numbers are going up, but again, we really need to keep on getting it up, and more up.
Okay. Yeah. And I see that the latest regulations have just come out, Kevin, literally as we're sitting here talking. So perhaps we can have a look at those here in a second. But so again, folks, if you're just joining the program, this is a CMR COVID Spotlight series that we're going to be doing at least over the next month, where we will have experts. Kevin is kind of taking the lead on this project, coming onto the show and sharing with us from their knowledge base, what has been happening in the world of COVID. So we'll have an epidemiologist joining us, for example, in Wednesday's episode. So if you're one of those people who have a lot of questions about the vaccine, even just the virus, an epidemiologist is your go-to person. That is an expert. That's all they deal with, folks. So you want to make sure that you tune in for that. Have your questions ready. If you want to submit questions in advance, you can certainly feel free to do that as well. But we're putting together this panel of experts from all over the world to really give us some key insights into where the virus is, how it's trending, and what options are available. Good evening, Gina. What options are available for everything from treatment to vaccination, what's happening elsewhere. And I think those are it's important information that we all need to have. So as Kevin said from the onset, there's a lot of misinformation out there. And unfortunately, misinformation never suits us well in terms of our decision making. You need to make decisions from an informed position. And I think sometimes people will question the local experts if they know what they're talking about. So we've decided to really rely on worldwide experts that have those credentials that you almost can't question because of who they are and what they're bringing to the table. And maybe that might convince some people. I mean, I'm not entirely sure.
Yeah, we could only hope and only try.
Yeah, for sure.
Yep, and I mean we're
Absolutely.
bringing on some very pretty significant names, especially who I work with in the Florida area, the Central Florida area, which we have University of South Florida, and we're going to have some very high level individuals that will be coming on, and we could get to some of those topics in just a bit. But before we get in some of the topics that we are going to highlight, let's go over a couple of the news stories. I know you just sent
Sure.
one out as well,
Yeah.
and kind of see what's going on in the world of news. I think the one you just sent out was the American Samoa has its first COVID-19 infection.
Yes.
Again, COVID is just starting to spread out
Mhm.
there.
Yeah. And it's amazing that all of this time that they've actually been COVID free. I mean, that's what I found amazing about that story. Not even
Mhm.
that they've had their first case. I found it amazing that there's anywhere in the world that hadn't yet been touched by this virus. So,
Yep, and,
you
and
know,
it was
that's
from a travel from Hawaii, I think is what the article was saying. So I mean,
wow.
they got that case, and earlier on you sent out one that's posted on CMR. COVID tester at doctor's hospital conceals connection to the North Side outbreak. What's that about?
So this is a very interesting situation. So we got word earlier today that there was a tester. She's only been working for about a month or so at the doctor's hospital. When I say tester, she actually swabs. She does the nasal swabs for COVID-19, and apparently, she has tested positive for COVID 19 now herself. And there are people who have said to me, well connected sources, that she was not entirely upfront about her connections to North Side. The alarming thing with this situation, because they're saying, listen, on the job, you know, she should be fine. She's wearing PPE equipment. So people should feel safe. But I think where people probably need to be more concerned is not at doctor's hospital per se, but the fact that she is someone who takes the public bus. And we've heard, even on this program, that there have been some issues regarding the public bus and people not always masking up and no real enforcement by the bus drivers. So here's someone, at least for the past month, that has been back and forth on the public bus, driving up and down, riding the bus, I should say, and in potential, you know, close contact with individuals for what would you say the time frame is to get from Georgetown to North Side? Well, it certainly depends on the time of day.
Yeah, it
If
depends
it's
on the time of day,
traffic,
but anywhere between 40 minutes, 45 minutes, and
an
upward to an
hour,
hour,
yeah.
depending on traffic. Yeah.
So that's certainly enough time to potentially be exposed to this individual if you were sitting right next to her. How will they contact trace on a bus? I have no clue. I don't even know if that's possible, to be honest. But you know, the officials definitely have confirmed it. They said that Doctors Hospital is actually working with them to try to do contact tracing. And in addition to that, the Doctors Hospital themselves issued a statement, which was very brief. Let me just see if I can find that here, Kevin. It basically said that Doctors Hospital discovered a team member at one of their COVID-19 testing facilities had tested positive for COVID-19. And some key points to note: this team member worked at this particular testing facility in full personal protective equipment, has not entered the main hospital, nor did they have any contact with core hospital employees. And then public health was immediately engaged and contact tracing was completed. I don't know how that would have been completed, but anyway, the team
Well, it was
member,
completed to the best they can, because remember, with
yeah,
contact tracing, it's based on the information that they receive. So after a while, I
exactly.
mean, it's not 100%, but they did all they can with the information that they had.
Right. So she's now in isolation until she can get the all clear. And then they go on to say that this case indicates that our testing procedures have been working. All of our strictly enforced safety precautions and infection control measures to minimize COVID-19 transmission risk remain in place, including regular, frequent testing of all team members, regardless of their vaccination status. And of course, we know that she was not vaccinated. And I think that that's an important point to raise at this particular time. One of the interesting things that people may have noticed with the new COVID dashboard that the government has kind of revised a little bit, let me just show this to you guys here, is they are now indicating for the new cases whether someone is vaccinated or unvaccinated. and whether they're a community positive or a travel positive. So this
Hmm.
gives us a little bit
A little
more
bit more info.
insightful information, Kevin. Yes,
Yeah,
absolutely.
that's what I was trying to remember when I was kind of opening it up. I'm like, there was something new, and then all of a sudden, I guess the nerves got me a little bit, and all of a sudden, I was like, wait a minute, I forgot what I was trying to say was new, so I just kept on rolling with it. But thanks
Yeah.
for re-highlighting that, because that is an important
Yeah.
feature that's been added.
Yeah, because there is this whole debate. And of course, when we have the experts on, we'll be talking to them and asking them this question directly in terms of your ability to catch COVID. So, the vaccine gives you certain protections in different areas, and it does
Hmm.
reduce your chances of catching it in the first instance. And that's important. It doesn't mean you can't catch it or it's not possible to catch it even though you're vaccinated, but it does reduce that. And of course, where you really get bang for your buck is in terms of keeping you largely out of the hospital and out of death, death's door in most instances. Not everybody is that fortunate, however. And of
Hmm.
course, other big news, Kevin, is this pandemic actually now has surpassed the flu pandemic and the impact that the Spanish flu pandemic had like over 100 years ago, in terms of being the most deadly pandemic to hit the U.S.
And Sandra,
So
I want to actually highlight something that's just on that very topic as well. Let me see if I could pull it up real quick. I'm going to pop it in here in just a
sure.
second. And this is a little different than what you said, but it's something that's very, very, very telling.
Yeah.
Let me see where it is.
So, folks, while Kevin is doing that, COVID-19 surpasses the 19 flu as the deadliest pandemic in U.S. history. This made news late yesterday and into today. So, COVID-19 now has a very interesting, I guess, marker historically, and it's quite a quite an amazing feat that it is now the deadliest disease in American history, surpassing the death toll of the 1918 flu pandemic, which caused the loss of more than 676,000 lives in the United States alone to that disease that in that instance lasted, in the instance of COVID, the last year and a half. So this is information coming out of World Health Organization when they first declared it a pandemic on March the 11th of 2020. And of course, we'll remember that date because the world was paying attention to what the World Health Organization was saying, and they raised the alarm. So, for more than a century, that's 100 years, the influenza outbreak of 1918 held that grim distinction of being the deadliest disease in American history. And now that has been, sort of taken over by COVID. So they had three distinct waves of that one, and the virus infected more than a quarter of the US population and caused average life expectancy to drop by 12 years. I mean, this is some amazing information in terms of how pandemics work. Back in 1918, your life expectancy dropped by 12 years. Um, so this was the catastrophic situation there. Of course, the most interesting thing about the Spanish flu is times were very, very different then. They didn't have the medical advances that they have now. And I want to show you guys some photos from that period before we cue Kevin back in again. But here is this is a news story from National Geographic. And here is some very, very interesting information. So this is a screen of nurses. This is what they had for hospital beds. This was a hospital, an outdoor hospital. Canvas tents kept the sick separated and less likely to spread the deadly virus. They were also doing fresh air therapy on tuberculosis and so on. So, they didn't have the modern penicillin and all these other things available. I don't think they had penicillin then, but, there's a lot of advances in medicine that have happened since then. So here we have, again, campaigns. They're putting up billboards even back then, protection against polio, get yours today, encouraging people to be vaccinated even then. But of course, we know this was the CDC's public health image library, this particular image. Workers paint a sign. You imagine, Kevin, they had to hand paint signs back then, where they were advertising 2 shots of the vaccine as better than 1 shot in protection against polio, because of course, diseases like polio at the time were also a huge concern. Another public health issue. This was a quarantine camp. So apparently the Spanish flu did not hit Australia until 1919. And I was speaking to someone today, Kevin, about this and about the fact that in this day and age, travel is so much quicker. We can literally get halfway around the world within the matter of just a couple hours because of flights that are available to us.
Yeah, that was certainly not possible back then when that was going on. Absolutely not possible.
And that spreads, viruses so much quicker than we can possibly imagine. And of course, American Samoa, like I said, I was surprised that they hadn't yet had a case. To me, this is quite shocking that 18 months, it took 18 months for them to finally get infected. I don't know where else in the world hasn't yet had a case, but this is quite unusual. So here they have, again, it reached Australia in 1919, and they set up these quarantine camps, like this one here that's in Wollongara, I think I'm pronouncing that right, Queensland, where, again, they were treating and trying to contain the illness. So back then, folks, if you were sick, you didn't have the option of probably staying home. They were trying to isolate you from others as much as possible. And gosh, I can only imagine the rudimentary, rough lifestyle there. So here's a young Native American boy in the Yukon Territory. He's being checked for smallpox. So again, these are serious diseases and illnesses that have largely been eradicated thanks to vaccines. So he's being checked for smallpox and vaccinated against the disease. This photo was taken around 1900. Smallpox has actually killed some 300 million people worldwide in the 20th century before it was eradicated in 1977. I find this so amazing, Kev, because again, going back to what I've said often on this program, most of us don't know life with these diseases. I mean, I have only heard about smallpox. 1977, I would have been just a toddler, right? Mm-hmm. So I don't have any experience. I've never seen anybody with smallpox. I don't know what that disease is, but it was apparently a disease that killed 300 million people. And it also, was very disfiguring. Someone sent me some pictures the other day of what it would do to you. And it says here that today the biggest threat from smallpox comes from its possible use as a bioterrorism agent. So I can't believe that it's still around in any form, but I guess so. So again, this is 1918. A nurse takes a patient's pulse, at the Walter Reed Hospital in Washington, D.C., while wearing a makeshift mask. So look at the rudimentary mask in her face, huh? Mm-hmm. They didn't have the benefit again of the nice fancy mask, the ND. What do we call
N95s?
N95s mm-hmm. that we have. And again, this virus infected more than a quarter of the U.S. population and caused your life expectancy to drop significantly. This is the first official cases of the 1918 flu pandemic were recorded at the U.S. Army's camp in Funston, Kansas, where this emergency influenza ward was actually set up to treat patients. And, interestingly, the thing that spread it back then, it was travelers again, but it was actually the military. So, World War was happening at that time, and it was those individuals that would have been spreading it. So here's a young teenage boy being vaccinated against smallpox by a school doctor and a county health nurse in Gasport, New York, back in 1938. Mm-hmm. Yeah. All right, Kevin, let's bring up.
Let's take a look at this graphic that I was showing you. Yeah. So, when people want to argue saying, oh, COVID is like a flu. Well, let's take a look at the flu over the last 10 years. 10 years, 359,000 deaths linked to influenza, to the flu.
Mm-hmm.
Now let's take a look at the deaths for COVID alone over the 19 months, just about 2 years, nowhere near 10 years. 635,603 as of about a week ago. You want to tell me that COVID is no worse than the flu? Come on. I really, really want
Yeah.
people to stop that argument, that disinformation that is spreading out there, because they need to know the facts. And when I saw this graphic kind of make its way on my Facebook feed, I was like, oh, let me check those numbers to make sure. And sure enough, when I pulled up the data, it was accurate. And so I'm like, yeah, well, this is a good graphic for me to share, because that just takes
Yeah.
out that argument altogether.
And I mean, it's the short amount of time that it has cost so many lives, really. It's not a situation where it's comparing apples to apples until you break it down like this, and then you have a real idea of what it is you're talking about. So a 10-year period of time, you've got half the number of deaths basically compared to what has happened in 19 months. I mean, imagine if COVID continues trending the way that it does.
Yeah.
My gosh, there'd be no comparison at all.
Yeah. And I can't believe how many deaths, and this is just in the United States. So that's not even the rest of the world.
Right.
But then when I was looking at the deaths in January, for some reason, I guess I just didn't realize how bad it was December and January when it came to the deaths as well for COVID. It was significant. And that was right before, vaccines really started to roll on out. And if you just look at the data from when vaccines came out, you could just see that impact just from that alone as well. So but again, we're going to have experts really, coming on and bringing more information. I don't know, for everyone watching right now as well, I'm going to ask you to do me a favor, because we're going to highlight some of those real topics that we're going to be discussing soon. But I want you to also let other people know that we're having this show tonight, just so people could start to get familiar. So if you don't mind, take a moment, share to your Facebook page, share to your Instagram page, share on Twitter, share on LinkedIn, share wherever you reach people, and let them know, please, that we are currently live, so they could also get that information, and let people know that every Tuesday and Thursday night, Sandra and I will be here with different experts from all around the world to share different facts. We're going to have a bunch of different topics, and we could get into some of those topics again. On Thursday night, this Thursday, September 23rd, we have an epidemiologist, Michael Weiss. He is actually the chief epidemiologist that works with me at the Florida Department of Health in Hillsborough County, and he's going to be on the show to answer your questions that he's able to answer under what he understands in the epi world. And he's going to give us a good overview of the current situation in the United States and abroad. So again, if you have any type of questions on what he does and pretty much his expertise, please join us for that show. So you could definitely hear feedback from him. And then we do have another show coming up with a pediatrician. And that topic is going to be COVID-19 and children. So that's a good show for all our parents out there, or parents to be. She's going to be talking about the importance of protecting children, as well as her thoughts of get them getting vaccinated, as well as she's going to talk about her experience taking care of children in the hospital with COVID, RSV, and other things that might have her experience dealing with children. So another confirmed guest that we have is going to be COVID-19 vaccines, cons, pros, and clinical research. Dr. Kevin Sneed, he is the Senior Associate Vice President from the University of South Florida Health, or USF Health. And he's also the Dean of USF Health College of Pharmacy. So he's, takes care of the pharmacy program at that college, as well as he has a pretty significant position there. He's going to be on and share some information, as well as Nazneen Powell. She's an epidemiologist that I also work with, as well as some of the other colleagues that are currently, and I said currently, involved with ongoing trials. One of the trials that's ongoing is, one of the vaccines that is widely available. Even though the vaccines have levels of approval, does not mean that trials don't continue. And they're
Yeah.
also researching other things. So they'll talk about what they're currently doing, as well as how trials work in general. So again, that's going to be an awesome show for folks to get some information on that. Sandra, you got something pulled up on the screen you want to share?
Yeah, have a look at this. This is a very interesting sort of graphic of the number of people that have died. This is a visual of it. So every single name was put on these little pieces of paper. So they did little white flags among the hundreds of thousands placed beneath the Washington Monument. And the scale of the flags represent the large death toll of COVID-19. Wow. I mean, it's,
Significant.
yeah, it's shocking. I mean, it looks like it
Yeah.
goes on forever. And these all have little things. So visitors are able to write personal messages to loved ones with Sharpies on the white flags at the National Mall. And this flag has a dedication, for example, this one here to Dominique Warren Stevenson, and reads hundreds of thousands of needless deaths because of incompetence. Thank God for the President Joe Biden. May God bless us all. So that one took more of a political turn, but people can, a lot of them are blank, but people who have lost a loved one can certainly, put their information there. And this is what it currently looks like. I mean, to me, Kevin, the thing that is incredibly shocking is the fact that in some instances, entire families have been wiped out by COVID. So Carol makes the point that, of course, there wasn't air travel in 1918. It was, a lot of people returning from war. And you know what is so interesting about the Spanish flu? It actually didn't start in Spain. I don't know how they came up with the name Spanish flu, but it started on American soil. At the training camp, and I think it was Texas, maybe. A soldier reported to the infirmary at Army training camp in Fort Riley, Kansas, with a fever and flu-like symptoms. So he was the first patient that they were aware of. And then more than 100 other soldiers came down with similar symptoms within a few hours. So the disease then quickly swept the world. And of course, American soldiers were being deployed to Europe on the front lines for the First World War. And that is what really spread it.
One of the things, I know how they, started to do their vaccine effort back then, from what I understand is, they just went door to door, joking people. Joop, joop, joop. Now that would never ever happen.
Here's a little interesting tidbit about how it got its name. So listen to this, Kevin, media trivia. So wartime censorship meant that the US and European media were not permitted to report on the outbreak. Spain, however, was neutral in the conflict. So the country's newspaper reported so extensively on the disease that it became known as the Spanish flu. So that's where it got its name.
That I did not know. Interesting.
Interesting. Rachel says Bermuda is now seeing a spike in cases, 10 deaths in a month, over 753 new cases in 7 days, 12 in the ICU, 54 in the hospital. Could this happen here?
Well, one of the upcoming shows, there is going to be actually someone's going to do some predicting for Cayman. That's going to be Dr. Edwin Michael. Google his name. He's going to talk about the evolution of COVID-19 and predicting Cayman's future outbreak impact. That show is scheduled for October the 14th. So be sure to tune in and hear what he has to say. You could ask him how he does come up with some of these prediction models. He's one of the resources that we use to kind of help, with some of our planning. So again, don't want to overly scare anybody, but at the same time, we want to keep people informed. And I don't necessarily think Cayman has a very scary outlook because we have a real good vaccination rate. But at the same time, we want the experts to give you the facts and the predictions. Of course, we don't have a crystal ball to exactly tell you what it's going to look like, but we could get some good guesses out there based on our vaccination numbers, our vaccination rates, also looking at lifestyles. He's going to talk about a lot of things that you would never know what is used in order to do some tracking on seeing how people are living their lives. And let me guess, you know these things? Cell phones? some of the data comes from that, based on what you're doing, where you're going, and there's geo stuff tied to it for different models to come up. So again, tune in for October 14th segment, and you'll hear a lot of interesting feedback on that.
Interesting. So again, folks, thank you guys so much for tuning into the program. If you're just joining us, we do have a special series for you guys. It's basically CMR's COVID-19 Spotlight Series every Tuesday and Thursday for at least a month. Lots of experts. Kevin has been doing a lot of work behind the scenes, getting people lined up. We're still trying to confirm some guests, in particular the local guests for the program. So hopefully they'll be coming on board with some level of confirmation soon. But in the meantime, we've got experts. I think we're going to have another epidemiologist, or he's the
From Baylor?
of the medical school there at Baylor University. We've really extended our contacts. Kevin, have we found anybody in the region that we could talk to, like at UE, to kind of?
I haven't had anyone from the Caribbean confirm yet, but I'll certainly do some more work on getting it, because we have a lot of other topics that are out there that are, and of course we want to make sure that we're getting good experts, not just because you got doctor by your name makes you an expert on the topic. The people that will be talking on the various topics that we have are definitely people who are extremely, extremely qualified to speak on those topics. So I want to make sure people know that these are very valuable individuals, and working with their schedules is somewhat difficult, but we feel it's very important to make sure that we're doing our best to keep people informed.
And we're going to have a discussion at some point, Kevin, about this concept of, I might do this as part of the morning show, but there's a concept of what's called COVID zero approach, which is basically what we've been trying to have, like zero cases of community transmission, where we're mandated lockdowns, hotel quarantines, and other measures to try to stamp out transmission. And the bottom line is, I was saying this to someone earlier, this is not a sustainable position long term. So we'll delve into COVID zero approach. Even the Chinese are recognizing that it just isn't sustainable, and we'll see why that isn't sustainable. Maybe we can touch bases with our economic professor at Yale and see if he can join in that conversation, because I think from an economic perspective, mental health and otherwise, there's some real issues with trying to maintain that level of sustainability, really.
Absolutely. And COVID, everyone should know by now that COVID will never, ever really go away completely. Now, medications to treat it's going to get better. More people are going to get vaccinated. So we're going to find better ways to live with COVID. There's, we know a lot of the solutions to make sure that we're protecting many, many lives at the same time. Now, there's a part of it that makes it more challenging, and that's the human element, where a lot of people, they have the choice whether they're going to get vaccinated or not, and a lot of people have chosen not to get vaccinated or chosen not to believe in what a lot of the scientific data is showing. So, whatever your reasons are, that's all going to help determine how long this thing's going to stick around for. So we want to make sure that we just provide that information out there for people to ultimately make their informed decisions. We got a lot of different topics that's on here. We do have an expert from Baylor already confirmed for October 7th show that's going to talk about the history and effectiveness of COVID-19 vaccines, and then some other topics that we have, being prepared for COVID in your home and business. So that person that's going to actually come on happens to be my boss. He is the chief doomsday planner, really, that I work for. Remember, I told you what I do for a living. I work in public health preparedness, so we're all hazards. So it doesn't matter what type of thing it is, whether it's a hurricane, or if it's a pandemic, or if it's a bioterrorism type of event, any type of thing that impacts public health. we have to create plans in order to respond and protect lives. And
Mm-hmm.
so he's the director of our public health preparedness division, and he's going to come on one of our shows and talk about preparing your home and businesses. So, we're going to be living, like you said, with COVID around us. There's not going to be zero cases forever. We're going to have people exposed. So what do you need to remember to do, and what are some of the plans? Just like you have hurricane plans, what are
Mm-hmm.
your plans to protect your home? If you have a business, what are some things you need to think about? Have some standard operating procedures, some sort of plan
Mm-hmm.
for when you have an infected employee, or when you have something that happens in your business, that's going to cause your business to be impacted because of COVID. So he's going to give you some really good tips on what you can do on that. Um,
Mm-hmm.
Also, COVID impact on USA hospitals. There's no secret. You've seen a lot of the coverage on what Delta really did to stress the hospital systems out. So we're going to have someone talk a little bit about the experiences that happened here, and try to dive into how prepared is Cayman's medical system for COVID. Again, we're waiting to confirm some local experts to kind of walk us through some of those plans, so we could always be reassured that they're doing everything they can, taking those best practices. I know during one of the press conferences, it was mentioned, and I thought it was definitely spot on. I believe it was Premier Panton that had stated, we've had the benefit of watching the mistakes of the rest of the world. We've watched what worked for them, what didn't work for them, what we need to look out for, and with that knowledge, it would be certainly something that we have to make sure that we are protecting our medical infrastructure for when we do have different surges, which will end up happening once the borders completely reopen. So making sure things are in place for when we do have an increase in cases. um,
Right.
Going to talk to some frontline healthcare workers who have been
Mm-hmm.
on the front lines, dealing with COVID patients, and talking about their experiences as well.
Mm-hmm.
We have another interesting one that just came in this evening, actually, and it's a Caymanian who is a licensed therapist who wants to talk about dating and relationships during COVID.
Hmm.
So that will be one of the topics that we will discuss, because we know, people need to still be dating and meeting
Mm-hmm.
people, and there's a safe way to do that, and also the mental health element on that as well. So we're going to have some discussions with that individual on that. And
Mm-hmm.
again, that's a actual Caymanian that's overseas currently, who's going
Hmm.
to come on for that show. So more to come on that once everything gets all confirmed on the date that will occur, because we don't have the date yet. We're still working through some things.
Interesting.
Healthy lifestyle helps fight COVID. So we're going to have someone to talk about, we know our Cayman diet's not the most healthy food. We don't make the most healthy food choices with our town.
Yes.
I love my cassava cake. I
Yes.
love a lot of,
All of our
oh
starches.
yes, I know a lot of people do too. So that diet doesn't necessarily help us a whole lot if we were to get sick. Even though we're
Yeah.
vaccinated, I mean, yes, the vaccine helps you out, but it's not the only solution. You still have to do a lot of other practices in order to make sure you're protecting yourself the best way possible. You got to wear your mask. You have
Mm-hmm.
to not go into big old crowds with a lot of people around, especially when we have a lot of cases around. But right now, it's not that way, but at some point it might be that way. So you want to avoid certain situations. You want to, again, obviously be vaccinated, as well as you want to make healthy food choices, because anything you do where your immune system is not where it needs to be, it's going to
Mm-hmm.
have an easier opportunity for COVID to take you down. So we don't want that to happen. So we're going to talk about the benefits of making sure you're eating healthy, and that should be something not just because of COVID, but something you should also take in the world way after COVID is no longer a big deal for us.
Mm-hmm.
Again, another topic that we have is how vaccination rates impact hospitalizations. So that does go in a little deeper on looking at, when you have a high population, a high percentage of vaccinated individuals. Like Cayman is leading, one of the top places in the world that have a very high amount. I think we're in the top five, or if not the top 10. I don't remember if we're, I think we might be six. So I will say the top 10 is going to be the safer figure when it comes to having people fully vaccinated. So we're going to kind of dive into that topic to see where Cayman really places in the world. And then we're going to talk to some people about their own experience of COVID. I had COVID. Here's my story is the name of that one. So, some people, they were fine. Other people, they didn't do as well. So we're going to hear their stories. You could hear what their experience was, and also treating COVID-19. You hear a lot of different things that are out there that are not proven methods. We have heard a lot of other things that might have emergency use authorization, or it seems to be working, but it doesn't have full FDA approval. And then there's a lot of other things that goes on into treating COVID. So again, that's one of the topics that we will go into. And then we'll also talk about understanding variants and mutations, because the Delta variant was not the only one, or will not be the only one that we'll face. There's going to be other ones in the future, and we don't know what it will look like. It could be not as bad, or it could be worse, a lot worse. So how that happens, and kind of, having a better understanding of what causes these things to happen, and how that impacts everyone as well. So we have a lot of really exciting topics coming up. We're open for other ideas. If there's a topic that you might want to have an expert on, please send it to us. And it's tips@caymanmallroad.com, right, Sandra?
Yep.
So yeah, send it to tips@caymanmallroad.com, or you could WhatsApp it to on the number, so we could see if we could identify an expert out there. Again, we're not using experts that are not vetted. We're making sure that we find people that are certainly in a position where they're able to speak on the topics that they're going to be asked to speak on. And again, when you have questions, you can send us questions ahead, or you could message the questions live, and we will certainly, get your questions answered by those experts that are out there. Will we be able to answer every single question that comes in? No, but we will definitely do our very best to try to answer it. And if there's just not an answer to give, we will say so. We're not here to make up anything. We just want to give you the facts as we get them.
Okay. All right, folks. So Rachel, thank you for your support. Rachel says, well done, Kevin and CMR, for getting all those amazing experts in. Looking forward to learning a lot. Hopefully all of you will learn a lot. None of us here are qualified. We speak on it because we do research and we read what the experts are saying, but I think it's nothing like having access to the experts directly, and you get it directly from the horse's mouth, where these individuals can say, hey, this is what it is. And, they speak from a point of authoritativeness because they are experts in their respective fields. Good evening, Paul, joining us from Bermuda. Thank you so much for tuning into the program. Again, folks, this is CMR's COVID Spotlight Series every Tuesday and Thursday for the coming month, or possibly more. We're going to be here talking about a number of different things, all sort of COVID related, everything from relationships to, COVID Q&A, knowledge base, testing, vaccines, the future, Cayman's preparedness. We're waiting on some local expertise to come on board to give us details on that. Sharm says, nice one, Kevin, thumbs up. So Kevin, we're probably going to cut it short just a little bit this evening.
Yep.
Because essentially we wanted to just do a bit of an intro show to tell you guys what's coming, to make sure you tune in. So the next segment will be on Thursday evening at 7 p.m. They're an hour long, which I think is, more than manageable in the evening hours. But it's going to be packed full of information that is going to benefit, I think, all of us, really. So share the link, folks, for this evening's show. We do have it up on the website, so I know that there are a number of people right now who are watching it as well. let people know that the series is coming up. We've had people saying, well, why can't we have an expert? Well, now this is your opportunity to actually have an expert speaking directly to the Cayman audience.
Absolutely. And
And Kevin,
again,
thank you very much for all of your hard work. Kevin, in his spare time, has been, working his little keyboard fingers, working magic, calling people. He's well connected there in Florida, and he has been working his resources to really put this together. And good evening, Stephen. And I'm just here for the ride and to learn as much as I can as well.
yeah, no, I mean, my passion is to do my best to be able to give back. I've always been a public servant. When I was at Cayman 27, my job was to inform people. And then when I moved here, again, all of my roles is all about informing people and making
Yes.
sure people have that information. And it's my gift to try to give back the way I can. And so all I want to do is look out for everyone that I love back home. I love every one of you, and I want to make sure that I'm doing my best to serve in a way that I can.
Yeah, awesome. All right, Kevin, have a good evening, everyone that is tuned in. Thank you guys so much for tuning in. Rachel, Ezra, Paul, Sharm, Ingrid, thank you guys. Tracy, of course, Lulu. Hey, Lulu, I haven't seen you in a minute. Carol was here. Benji is listening on YouTube this evening. And Miss Juanita and everybody else that's listening, thank you guys. Louise always here. Eddie and others, thank you for tuning in. I'll see you guys in the morning at 7:30, bright and early, for Hump Day Wednesday segment of the Cold Hard Truth.
Have a good night.
All right, guys, take care.